Hello, my name is Rachel Tilley. I am the director of the Vaccination Outreach Program here at the Community Health Center Association of Connecticut. This grant is focused on reducing vaccine hesitancy among vulnerable populations within the state of Connecticut. When we applied for the funding for this grant, one of the promises we made was that we would connect with 75,000 unique individuals. And we are at 6,800. And I have to say that I am so incredibly proud of this team. I can't imagine us accomplishing these goals with any other group of individuals.
My name is Nancy Serrano and I'm a community health worker at CHCACT.
My name is Nikenia Darman. I'm a community health outreach worker.
My name is Christopher Matthews. I'm a community health worker.
Hi, my name is Paige and I am a member of the CHCACT team.
My name is Heather Adams. I'm currently in the role of Director of Training and Education. The vaccine program started as sort of a glimmer in our eye and an opportunity for us to better serve our communities. And it was really focused on helping to provide correct information.
When you're talking about massive demographic ideological questions that people have, one of the first questions I ask is why? Why are people hesitant to get the vaccine?
I think a lot of people in my community are vaccine hesitant because they're misinformed. There's a lot of historical context as to why that is, especially for the African American community. But I've been able to break those barriers down by providing this vaccine education information.
The most important component of the CHAT program was the people. And recruiting a team that was diverse and that had different types of strengths, where you had a spectrum of different experiences that would all feed into each other.
The folks that put this team together really prioritized diversity, really prioritized putting together a team that was going to represent the interests of the people that it was going to be serving and have the life experience to relate to folks in these communities.
Mi experiencia trabajando con mi comunidad fue muy importante para mí porque yo sabía que no todo el mundo tiene acceso a los recursos en español y para mí eso fue extremadamente bueno y me sentí que estaba haciendo algo muy bien para mi comunidad.
I was born and raised in Waterbury. Most of my outreach and work has been in Waterbury, so it's been really satisfying to know that my community that I grew up with was able to get that information, because normally lower income areas like that are usually the last to get information in terms of anything health related, not just COVID-19. So to see that we were able to assist not just Waterbury, but the New Haven, Bridgeport, Hartford, New Britain, multiple different areas in Connecticut. It was great to do that.
As an African American woman in Connecticut, advocating inside these communities, I think the number one thing that has helped me definitely connect with people and kind of get rid of those hesitancies and truly talk to them is being relatable. I talk to them like I'm talking to maybe a friend. I'm not talking to them like I'm their professor or somebody that's higher than them. I'm speaking to them like I'm on the same level as them.
And I really reiterate that because that's very important for people of these communities to have someone who looks like them preaching the good word and trying to give them correct information.
We knew going into this project that health centers were going to be our ally and that they were going to be a great resource for connecting with the community. But we needed to find people who weren't utilizing primary care, who weren't utilizing these health centers, who may not even know that these health centers exist. So we had to seek people out wherever they were. At the grocery store, we were at bus stations, we were in churches, we were participating in food shares and food banks.
The difference between other community health workers and our chat team is that we were extremely consistent. Every single week we would have all these events and canvassing opportunities, and we would continuously go into these communities and talk to individuals to the point where they would know our name, they would know who we are, and they would keep coming back just because of the people that we were and the work that we were doing.
For example, I do the Heartbreak Library every Thursday. I had a woman last week come to me and she actually got a booster that same day after talking to us. So she came back next Thursday and said, I'm glad you guys were here because I was able to, get that information about the booster. That right there was like a full circle moment because it's like, wow, sometimes we just can't really measure the work that we're doing and the impact that we're having on people. But for somebody to come back and say that means the world.
It was always great for me to hear from some of our health center partners that they knew the names of the chat members and being able to say, hey, I know Rachel, I know Nancy, and they're doing great work.
We knew there were going to be people that were not engaging in community activities and the outreaching to them would need to look different. So we utilized social media to be able to do that.
I didn't actually think that social media would contribute as much as it did. And I didn't think that I would be kind of a part of that contribution in the way that I did. But I think looking back, that was the best way to communicate with people because really when we were in the field, there were people who at times didn't want to talk, but we were able to get that message across to them via social media. Or they were more interested in following us and just learning on their own.
We have some people that do not want to talk to us at all. COVID-19, that's a very sensitive topic. And then we also have people that are excited that we're out here doing this work.
As a teacher, I definitely felt like there were moments that were teachable and moments where you let it go. We were trained to ask questions that didn't put blame on people. For the people who were like, no, we haven't been vaccinated, the question was, what's been keeping you from getting it?
Everybody is entitled to their own opinion, their feelings on it, and I have to respect that. So I'm coming in as an educator, not as like I'm pushing my agenda on you. And working in this field and being a parent was important because I felt like it helped me be more passionate when I was speaking with other parents. It's important when you're spreading your message to believe it because it shows when you're talking about it. And they're gonna feel that energy from you, that this is something important and this is worth stopping for a minute and hearing me out.
I was able to learn a lot. The rate of maternal mortality and infant death has been on the rise. So that was like something I was really passionate about. A lot of the pregnant women I met were concerned about their unborn child. So gaining their trust and letting them know my experience, it made them like more comfortable and more trustworthy in the vaccine. And that gave me a lot of confidence to go out into the community.
I never thought that I would be doing this kind of work, but I feel like I kind of am finding my purpose.
Working on this team has been really a gift. It's been a wonderful 10 months. We've had 2 really phenomenal supervisors. The organization really does genuinely care about your mental health, and that is just really, really amazing to see in a company.
Oh my goodness, yes. I loved being on this team. Everybody was very supportive. If I ever needed anything, it was available to me anytime.
Not to toot our own horn, but I am going to toot our horn because I'm so proud of our team. We needed to connect with 75,000 unique individuals by April 1st, and by the beginning of March, we had already connected with 79,000 individuals about COVID and provided them with resources and education. I'm just so proud of how far we've come, the things that we've learned along the way, the adaptability of our group, and the huge service that we've provided to our communities.
While this program may be ending, I think the chat members, the chat idea, will live in perpetuity. As we get other funding opportunities, we can fall that under the umbrella of chat. I am gonna be sad to see them go. They have brought such an energy and such a light to this organization.
I'm so sad to see this grant come to an end, but I'm so grateful we got the opportunity to do this work.